Hello, everyone, and welcome to today's MS Aesthetics Open Day. Thank you for joining us. My name is Antonia Fadiou, and I will be your chair for today's session, along with Kishan Sheth. I'd like to say a few things about me first. I'm a plastic surgeon and a former postgraduate student at UCL. I studied the surgical pathway of the Aesthetics MS and graduated in 2022. And I'm now practicing at the Department of Plastic Surgery and Burns Intensive Care Unit at the Nicosia General Hospital. Also, a few things about my co-chair, Kishan.
Thanks, Antonia. Good morning, everyone. My name is Kishan Sheth. I'm a cosmetic and restorative dentist based in London. I undertook the MS Aesthetics course at UCL in 2021 to 2022, and I undertook the MS Aesthetics minimally invasive pathway. I enjoy incorporating facial aesthetics into my work as a dentist, and I think that my progress on the course is a highlight of the fact that many different types of professionals, including dental professionals, are getting involved in this growing and exciting sector. Back to you, Antonia. Thanks.
Thank you. So we're planning through the session to help you gain more information on both pathways of the Aesthetics Master of Surgery at UCL, and also answer any potential questions you may have on several things. So our speakers, Professor Mosahebi and Dr. Mori, will kickstart the event by providing you with a summary of the postgraduate program, followed by the student experience narrated by me and Kishan. We're also very delighted to have Lauren from admissions here today and talk us through the application process. And finally, there will be an interactive questions and answer session with the opportunity to submit your queries about any part of the program that you'd like to ask. This session is being recorded and will be made available on our website following today's event. We're here to respond to your questions, so please share those throughout using the Q&A function on Zoom, which will come up in a while. Now to introduce our speakers, we have Professor Afshin Mosahebi. He's an honorary professor at the Department of Surgical Biotechnology in the Division of Surgery and Interventional Sciences here at UCL. Professor Mosahebi is involved in pioneering research work on tissue regeneration through new biomaterials and tissue engineering, as well as clinical trials in innovative techniques in wound healing. He and his team of experts lead a comprehensive Masters of Surgery in Surgical and Minimally Invasive Aesthetics at UCL.
And the second speaker, Dr. Zara Mori, obtained her PhD from the Royal Free Hospital at UCL and has many years of experience in research and education at academic institutions in the UK, such as Imperial College London and the Institute for Cancer Research. Currently, Dr. Mori is leading the MS Aesthetics program and is passionate towards improving the students' experience throughout their journey and time at UCL.
And Ms. Lauren Moon, she's currently working as an admissions officer in the graduate admissions team within student and registry services. She specifically works in the team that handles applications for graduate programs in the School of Life and Medical Sciences, which includes the Division of Surgery and Interventional Sciences, which houses the MS Aesthetics programs. So before I hand over to our speakers, we would like to run a few polls for you to answer. Please read each poll question and submit your answer by ticking the corresponding bullet point. So let's move on to our first question. Are you aware that we offer two separate pathways in Aesthetics MS? That's a yes or no answer. Single choice, remember.
And the second question, which pathway are you interested in studying? Are you interested in minimally invasive aesthetics, aesthetic surgery, or are you yet still undecided and looking forward to finding out more information about the two?
And also, where are you based? Either UK or overseas. Many of our cohorts during the years are international students, and we also have many home students as well.
And the fourth question, what is your current profession? Are you a dentist? Are you an ENT surgeon, a general surgeon, maxillofacial surgeon, a nurse, physician, pharmacist, plastic surgeon, other healthcare professional? So I think this is a testament to the wide-ranging diversity of professionals entering the area. So it'd be interesting to see who we have here.
So let's see your answers. On the first question, we're very happy to see that you are aware of the two separate pathways. It's the minimal invasive pathway and the aesthetic surgical pathway.
And on the second, we've got a split. So 50% of you are interested in the minimally invasive aesthetics pathway, and the other 50% are interested in the aesthetic surgery pathway.
So on the question of where you're based, all of our participants right now are based in the UK, which is very good. It's a flexible program, but being based in the UK is also very helpful for the face-to-face cadaver labs in the examinations.
And in terms of the profession, we have 50% being physician doctors and the other 50% being other professions. So I think that's quite interesting. There is a diversity of type of professional here.
That's fantastic. So thank you for answering our poll questions, and let's kickstart with the presentations, beginning with Professor Musahebi and Dr. Mori.
Good morning.
Good morning, everyone, or welcome. I'm just going to share the screen. Okay, hopefully you can see my slides. Ash, would you like to start?
Yes, good morning. Thank you. Thank you, everyone, and welcome. Thanks for joining us. Just a few words about our master's course. Next slide. So a little bit about UCL. It's an old university, as some of you might gather. Back in 1778, the William Wilkins, the English architect, designed the National Gallery as well as the Wilkins building, which you can see, the historic building. Hopefully you can come and see it in person. UCL itself has a number of major teaching universities within it. Royal Free, which is one of our main base, University College London, as well as Royal National Orthopaedic Hospital. So UCL itself, how it started, really, Robert Liston did the first operation under anesthetic in 1846 in Europe. So the history goes back quite a long way. And our vision really is, because of the current absence of standards and accreditation for non-surgical aesthetics in the UK and also in the world, actually, aesthetic surgery and minimally invasive surgery are sectors of medicine which are outside most of our trainings, no matter what specialty you are. So the idea was to bridge the gap between the aesthetics field and world-class expert. It's in partnership with Bob's. We provide a really busy people who are working full-time to continue working as well as continue learning and improve their skills and knowledge. So really our goal is to promote, implement an inclusive learning and teaching environment, as you saw from the number of intakes and wide intakes that we take, encourage professionals to study independently. It's not going to be very much spoon-fed. You're going to be professionals. You're going to be postgraduates, so teaching you to learn better and to techniques, improve your techniques, and really generate the frontiers of aesthetics and regenerative medicine by allowing you to do more research in the topics and the fields that you like. We have a number of different faculties from around the world, including dermatologists, cosmetic dermatologists, dentists, plastic surgeons, and also our fellows come back and teach us as well, as you can see from the introduction. So it's quite very flexible program. We have a wide spread of students and diverse personal background. understanding, to induce the understanding ability to really theory, and really it's a practically based, of course. It's not going to be all to do with theory. It's practically based, give you tips how to improve your practice and or start your practice. And also really the opportunity to undertake independent research in minimally invasive or aesthetic surgery.
Okay, thank you, Ash. So good day to everyone and greetings from UCL. I'll be talking about the various modules that we have on the program. Regarding the core modules, there are 4 of them, as you can see in my slides. So principles of aesthetics, a little bit about the skin in aesthetic practice and the fundamentals of aesthetics. Research project is also one of the modules that is core to both minimally invasive and surgical pathways. So if you join us, regardless of which pathway you'll be studying, you will be taught all of these 4 modules. But the research project is not a taught project, is the research one, as the name suggests. So you will have an opportunity to choose an area that's related to your field of expertise or an area that you want to learn more about. We do offer projects ourselves, but we encourage our students to choose something that they really are interested in, and will then pair them up with a couple of supervisors from our academic staff and clinical staff. So that's a great opportunity. And there is a chance to publish your work as well, depending on how well it is performed. With regard to pathway-specific modules, the minimally invasive pathway has got 2 pathway-specific modules. One which is related to minimally invasive aesthetics and the advanced part of that in the second module, while the surgical students will have their own 2 specific pathways modules, which is around the breast and torso, and the other one is head and neck aesthetic surgery. The diet of the program is you could join us to study full-time if you have a bit of extra time in your busy schedule, or if you are quite, engaged with life and your clinical work elsewhere, then you can join us over 2 years and complete it as a part-time student. So both options are available. The teaching is referred to as blended teaching, as in we pretty much have a lot of pre-recorded lectures and clinical procedure videos that are shared with you on our online platforms. And other than that, we have a number of face-to-face in-campus sessions where you're invited and announced. The dates of those sessions are announced in advance. You're invited to come to the college, meet the rest of the peers in your group, in your cohort, meet the staff and make a network connection, as well as obviously being taught in the college. We also are very lucky to have access to the Charles Wolfson Center for Reconstructive Surgery, where the cadaver labs are based. The virtual learning environment, or VLEs, that are available at UCL are obviously very broad. In our program, we use Moodle as the main VLE platform, as well as Microsoft Teams. So all the live virtual sessions are run on Microsoft Teams, and the sessions are recorded. If you couldn't join, you can always watch the recording. The rest of the information for each module is on the Moodle platform, which is the platform used across all the programs in UCL, whether they are undergraduate or postgraduate. In terms of assessment and feedback, you will be assessed in a range of methods. For instance, you will have to prepare e-posters of some of your work. In other cases, there will be a report or reflective case study. And for the pathway-specific modules for both minimally invasive and surgical students, there are OSCE exams, which are similar to medical school or dental school exams in the UK. We are aware that some of the international students perhaps are not very familiar with the OSCE examinations. So we do provide a mock OSCE or a formative assessment where students can get to practice and receive feedback before the actual examination. The feedback is in the form of oral or written, a combination of both depending on the situation, and it's provided to you by our team of academics and clinicians, as well as your peers. So you receive feedback in various forms. And the idea is to be a constructive one to help you progress in the next examination. Often, most of the modules have a formative exercise which is non-marked, and you will get an opportunity to improve after that for the actual summative assessment. When you join UCL, you will have access to a range of support for students, from well-being and mental health, disability support and counseling, interfaith at UCL, as well as being assigned a specific academic personal tutor, which is a member of our staff, and you will basically be guided. The academic personal tutor cannot answer all your questions, but they're there for you and they can signpost you to the right place should you have any difficulties or any queries regarding accommodation, fees, your well-being, and so on. Thank you for listening. I will be answering your questions at the end of today's session. Back to you, Antonia.
Thank you very much both for this wonderful presentation. Next, me and Kishan would like to speak to you about our experience as students at the Aesthetics MS with the next presentation.
Excellent, thank you, Antonia. So as mentioned before, my name is Kishan Sheth. I'm a cosmetic and restorative dentist, and I incorporate facial aesthetics into some of the treatments that I undertake on a day-to-day basis. I undertook the course in 2021, MS Minimally Invasive Aesthetics Pathway, and I'm really excited to be here with you guys today to share my experience.
And as I mentioned before, I'm a plastic surgeon in Nicosia General Hospital in Cyprus and have been a full-time postgraduate student at the surgical pathway of the Aesthetics MS at UCL, from which I graduated in 2022. And I'll be happy to share my experience with you as a student.
So some of the reasons why I felt that this course would be the right investment for me was that there was a real internationally established faculty. And I think that's important because we're learning about techniques and innovations in aesthetics, and having that rich perspective from practitioners who are not only located in the same country gives you a real broad outlook on how the aesthetic market is changing, flourishing, and incorporating different techniques. There was a real mix of students in our learning cohorts. So some of the other courses that I had been on as a dentist, the other attendees, my other course mates, and fellow students were also dentists. Here it was quite a rich dialogue because we had pharmacists, we had medical professionals and dentists all discussing things, and everyone brings something different to the table. There was a real emphasis on practical driven teaching. And I think that can be seen from the cadaver modules, because regardless of how much you're going to learn in the textbook, that cadaver module is instrumental in taking the theory and actually showing you the theory in a practical way. And the part-time nature of the program lended itself to flexibility, and I found it relatively easy to juggle my studies with my work. My research project was on the use of hyaluronic acid injectables in reconstructing lost interdental papilla. But basically, I took the aesthetic side and the dental side, and I did a research project that incorporated both. And I think it's a real testament to the faculty that they allowed and supported that. And we even got in a supervisor who was part of UCL, but external to this program to help oversee me and guide me along the way. So the faculty are quite open to different ideas, and I thought that was really, really good because it gave me a platform to take my work back and show my dental peers. And yeah, that's my perspective, and what I got out of the course and why I would recommend it.
I'd also like to talk to you about my experience as a student in the surgical pathway. It constitutes the only aesthetic surgery program at academic master's level, And the qualification comes from UCL, which is a worldwide established top university. As such, I had the opportunity to gain comprehensive knowledge on aesthetics by being taught by an expert faculty of both surgeons and aesthetic physicians. The students get to access an exclusive network of renowned professionals that are able to attain specialized skills, which they can also practice hands-on in the lab, which is very, very good during the cadaver days. This postgraduate program suits medical professionals very well, since it's very flexible schedule-wise, and it allows students to continue working in their respective practices, which is very important in today's hectic schedule of medical professionals. Most of the lectures are online. A large number of them is pre-recorded and can be viewed in one's own time, actually. Additionally, there are opportunities to engage in research at a rapidly evolving medical specialty. Actually, my research project was about the role of oral immunonutrition in aesthetic surgery. And during my work on it, I felt to be part of the collective effort in scientifically evaluating aesthetic practice.
And I just wanted to incorporate this slide because although the fundamental core of this program is aesthetics and the use of aesthetic materials in facial aesthetics, I wanted to show and illustrate actually how the science of aesthetics can be taken to other disciplines. So for example, with my dentistry, I took some of the knowledge of the aesthetic science, and as well as my dental work, I started to incorporate what is beauty, how do we make things more cosmetically acceptable, looking at the lips, the smile symmetry, the shade, the color matching, patient's expectations. So there's a real toolkit that I built from this course that will allow me to even take my learning to the dental area. And this is, a few of the examples of some of the dental cases, not even the aesthetic cases, the dental cases that I managed to treat during my time as a UCL student. They were done in my clinic, but I did take some of the learning back and implement it into my patient base. So I think that's really, really an exciting element that I was able to also gather, as well as the research and the understanding of aesthetic medicine, actually taking things back to my dental practice. And no doubt, even if your discipline is outside of full-time aesthetics, there might even be the opportunity to do something similar with your other disciplines.
And in my turn, I would like to expand more on what the surgical pathway of the aesthetics masters has to offer. The program gives the chance to both further the theoretical knowledge and train in hands-on surgical techniques concerning the face and the whole body in a safe and controlled environment through scheduled cadaveric sessions where we're directly supervised by a leading expert faculty. Personally, since I was on my final year of specialty training while I was completing the master's degree, it had helped me transition to being a plastic surgery professional from being a student and a trainee. And I felt more ready and had gained more detailed knowledge on my specialty. And as I said before, it's a great opportunity to be part of a network of leading experts in aesthetic surgery. And as a training plastic surgeon, I had a lot of refined knowledge on both surgical and minimally invasive themes. It helped me refine my skills and form lasting contacts within the aesthetics community. So I believe that this program is highly suitable for medical professionals who already have some basic experience in aesthetic surgery, as they will enhance their learning and acquire the necessary mentality to start their career in the aesthetics community. Thank you very much. And we will now move on to Lauren, as she will explain the application process which you will need to follow in order to apply to study this program at UCL.
Thank you, Antonia. Just bear with me while I share my screen. Okay. All right, can you just confirm that you can see that okay? Perfect. All right, so hi everyone, my name's Lauren and I'm a Senior Admissions Officer in the Graduate Admissions team at UCL. So as Antonia said, I'm just here to talk to you about the admissions side of things. So I'll be talking through the entry requirements for the programme as well as the online application process. So first, just to touch on the entry requirements. So they're fairly similar across both of the programmes, but with a few subtle differences. So for the minimally invasive aesthetics pathway, we're looking for either a recognised medical or dental degree, or we can accept advanced nurse practitioner qualification with NMC registration, or if someone's a prescribing pharmacist and registered with the General Pharmaceutical Council in the UK, as well as a minimum of 2 years relevant training. Whereas for the aesthetic surgery pathway, we are just looking for a recognised medical degree, but as well as a minimum of 2 years training in head and neck surgery, maxillofacial surgery, or plastic surgery. When we say recognised medical degree, I mean that it's recognised on the World Directory of Medical Schools, so you can check this before you apply. It's a publicly available website where you can search for your medical school and see if your school and programme is listed. So whether or not your qualification meets the academic entry requirement will depend on the country where you studied. So on the programme web pages and the graduate admissions prospectus for these two programmes, there'll be a drop down where you can select the country you've studied in, and it will provide more information about what qualifications from that country meet the requirement at UCL. If it's still not clear, please do get in touch with graduate admissions for further advice if you're not sure, using our contact form, and we can guide you before you apply. I think it's always important to note, as for all graduate programmes at UCL, that meeting an academic entry requirement doesn't guarantee that you'll get onto the programme. We do look at other aspects of your application, such as references, personal statement, and your work experience. If you've spoken to us, you've done your research, and you know that your qualifications definitely don't meet the academic entry requirement, just let the department know before you apply and see if they'd still be willing to make a case to accept you. We want to enable you to make an informed choice before you submit your application. And then the English language requirements. So if you're not a national of a UKVI majority English speaking country, you will need to provide evidence of your English proficiency. So UCL has 5 English language levels numbered from 1 to 5, and the aesthetics programmes both require a level 2. So if you're not a national of a UKVI majority English speaking country, you can meet through education. So this has to be a minimum of 12 months education leading to an awarded qualification in a UCL recognised majority English speaking country, and the qualification must have been awarded within 2 years of the start date of the programme at UCL. And finally, the most common way to meet the English language requirement is through an English language test. And this must be taken on or after the 1st of September, 2 years before the start of the programme. After I finish this presentation, I'm happy to just provide a link in the chat to our graduate admissions English language requirement webpage, which provides a bit more detailed information about all of the information on this slide. And just a note on the visa side of things. So as everyone's talked about already, we do offer this as a full and part-time programme. However, it is taught primarily online with a few bits of teaching on campus in London. So UCL can only sponsor student visas for full-time on-campus students. But because there's only little bits of teaching on campus for this programme, we can't sponsor anyone for a student visa. So if you are an overseas applicant and you know you would need a visa to come and study in the UK, you would just need to use a standard UK standard visitor visa to come to the on-campus teaching sessions. Please note UK immigration rules are subject to change after I've said this, so please do check it later down the line if need be. Okay, I'll just briefly talk through the key aspects of the online application form. So the most important section is the education section, and here we need to know about all of your qualifications from degree level upwards. So you'll need to provide up to 3 documents for each qualification. If you've studied in a language that's not English, we'll require both the original language version and certified English translations of your documents. You'll need to provide your academic transcript, which shows all the modules you've taken throughout your degree, as well as the grades you've achieved in each module. And if you've completed that qualification, we'll also need to see your official final certificate. It's really important that you do provide these documents at this stage, as not providing all of your documents can delay your application being processed later down the line if we have to contact you to request those. Then there will be a section to provide your English language test details if you do have them and they meet the requirement and it's in date. However, if you don't have that and you know that you would need it, that's fine. You don't have to provide it with your application. So if your application is successful and you're made an offer to study at UCL, we can just make it conditional on English language. It's always best to get your application submitted sooner rather than thinking you need to wait for your IELTS scores to come in before you apply. There'll also be an employment section, and how you choose to fill this out is up to you. There'll be a box, sort of different boxes that you can fill out with different periods of employment, or you can just upload a separate CV. And then the referees section will require you to submit details of 2 referees. We ask that at least one of them is academic unless you've been out of education for more than 4 years, and in which case you can use 2 professional references. Then we also ask you to use professional email addresses rather than sort of Gmail or Yahoo ones. And this is just so that we can verify the authenticity of the references. And the way it works is your referees are automatically sent a reference request email when you submit your application, and they'll be sent a link in that email to complete a reference view via our online referees portal. It's really important to emphasize that applicants themselves are responsible for ensuring that their referees submit references for them. UCL won't chase them for you, and it can delay your application being processed if you don't sort of make sure that your references are submitted, because we don't start assessing applications until we've received all the references. And there's also a personal statement section. So this is in the form of either a 3,000 character text box, or you can upload it as a separate 2-page document. We just want to know why you want to study this subject at graduate level and specifically at UCL. So this is your chance to demonstrate that you've really done your research about the programme and what draws you to it. We also want to know how your academic and professional background meet the demands of the programme. So what makes you a particularly strong candidate for the programme? And finally, we want to know where you would like to go professionally with the programme and how will it help you to achieve your career aspirations. The final step of the online application process is to pay the application fee through a platform called Flywire. So once you've submitted your application, you'll be taken to Flywire and prompted to pay the £90 application fee. The £90 fee is per application you make. So if you apply to the maximum limit of 2 postgraduate taught programmes at UCL, you would pay that fee per programme. So before you submit your application, please do check that everything is correct, because you won't be able to make any changes after submission. So we won't be able to accept any additional personal statements or things like that. So please do make sure that you upload the absolute final versions of everything. Once you've submitted your application and paid the application fee, you'll get access to Portico, which is UCL's applicant portal. And this is where you can view, manage and track your application. So once you've submitted, if your referees still need to submit references, you can send them a reminder email from your portal, but you can also substitute them for another referee if you need to get someone else to provide a reference more quickly. And if we request documents from you, you'll also need to upload them via the portal. So it's always important to just check your portal regularly, but also keep an eye out for any emails informing you that there's been a change in your portal. And finally, as I've already touched on, we can't begin assessing your application until it's what we call complete. So this means that you've submitted, you've paid your application fee, and we've received both of the required references. So that's just a brief tour of the entry requirements for the programme, both academic and English language, as well as the key parts of the online application form. I'll provide a few links to some useful information in the chat afterwards, but if you do have any admissions related queries, I'll be happy to answer those in the Q&A. Okay, I'll just unshare my screen and pass back to Antonia.
Brilliant. Thanks for that, Lauren. So now will be the question and answer session, part of the session. So this is the opportunity for any of the attendees today to ask some of the faculty some questions. We haven't got any questions in yet, but I would recommend, if you do have any questions, this is a perfect opportunity to ask them. Just while we wait for some questions, Dr. Mori, maybe I could ask a question to you. So over the course of the last 3 years, as this course has really taken off, what has been, what's your opinion on maybe the evolution of the course going forward? Because aesthetics is undergoing a lot of change at the moment. What's the long-term vision for the course? I think that would be really exciting to know.
Yes, thank you, Kishan. Very good question to start off the Q&A. The program has progressed systematically and very effectively since the start in 2 years ago. So this is our third cohort, graduating hopefully by the end of this academic year. And we have taken the student feedback on board after every year of teaching in the various modules. At the beginning, in the middle, and the end of the module, we have what we call a continuous module catalog, or a continuous module dialogue in a way, actually, where the students are encouraged to give us feedback as we are teaching them. So we don't leave feedback to the end where their time is finished and it will not impact them, rather it impacts the future generation of the students. So we've taken those feedbacks on board and we improved a lot of aspects of the various modules, brought new expertise from across the globe. Some of our students who are graduated, for instance, Antonio comes and helps us with some of the teachings in the cadaver labs, for instance. We have some of the colleagues who've introduced their expert friends from across the globe, and they add various lectures or slides to improve what we are teaching at the moment. As you said, Kishan, it's an evolving field, so we're updating the modules as we go along. There'll be always new ideas, and we're open to suggestions from students and the staff as we go along.
Excellent, thanks for that. We do have a question from Adama. Hello, for the minimally invasive aesthetic surgery pathway entry requirement, does 2 years of experience mean postgraduate experience? In September, when the program started, I would have had 2 years of foundation training post-graduation. I have already completed basic surgical skills training, foundation and advanced Botox and fillers training. Would Adama be eligible to apply?
Maybe I'll take that question.
Sure.
Obviously, if Lauren, you have anything to add, we'll hear yours as well. So it sounds, Adama, thanks for the question. It sounds like you have enough experience based on what you've written in here. Obviously, it depends on how you write your application form. And once you applied, the admission team, Lauren, and the team that Lauren works with, they will look at it first. Then they send this to us as the academic department. So we will look at the whole application form, the references, your personal statements, as was mentioned by Lauren as well. And then we make a decision. But based on the experience itself, since you have done some surgical skills training and advanced botulinum toxin and fillers training, which means hopefully you have perhaps observed some of the procedures, even if you haven't performed them, that's already being in the right track. So I would suggest that, yes, this is good for application, but then once we've seen the whole application, then we can make a decision, if hopefully that answers your question. Lauren, I don't know if you want to add anything to that.
Yeah, I was sort of going to say 2 years post-graduation sounds fine, but then I was going to default to you to sort of assess in more specific detail whether that experience that the applicant's got would be fine. So yeah, no, nothing further to add there.
And I mean, I could add also, Adama, that we do, since 2 years ago, Professor Masahabi and I do interview our candidates who apply after they've been sort of green flagged from the admission team that they're ready and they cover all the requirements that UCL has in terms of which university you've studied, where your postgraduate previous studies were, and references where they come from, and they're already there. Then we look at your application form in the sort of as admission tutors for the program, and we do offer a 10 minutes informal interview to our candidates. Perhaps sometimes there are things that we want to ask you that you haven't mentioned in your application form, and we would like to give you that chance. So you have that extra opportunity as well in the interview, which is very informal, just a chat to make sure that you know what you're applying for and the pathways you've selected is the right one. So there is a chance in there as well to kind of further explain something that might not have been clear in your application form. However, if we see that the application form does not totally apply at all for the program, it does not have the entry requirements, perhaps the student does not have any medical background or dental or nurse or pharmacist at the level that we have asked for, then obviously that would be an immediate rejection. But if you have the medical background, then we do give the students a chance in an interview. Hope that answers the question.
Yes, that's very, very helpful. We don't have any other questions that have come through, but those who have signed up for the interview will certainly have some communications from UCL. So there will be an opportunity to maybe ask questions after the interview. I'm going to hand back to Antonia.
Thank you very much, Kishan. And this marks the end of today's session. I would like to take the opportunity to thank everyone who participated in our event for all your comments and questions. And also a warm thank you to our speakers for an excellent session. If you have any further queries, please feel free to email us using the program's email address. That is adminaesthetics@ucl.ac.uk. You can see it in your screen now, actually. This is the email, This is the email address that you can use in case you need to ask any questions for the admissions process, for the program, on anything else that we were not able to potentially answer with this session. So thank you very much and have a wonderful afternoon.